The CED is planning for quite some time before COVID-19 to work on increased human capacity in the clinical engineering domain. Not only the recognition, but the actual competency and volume of people available. So number one, we need to focus on the individuals who are in the field, that they will be prepared to better understand, just like what we do today, what is the oxygen issues? What is about the supply, the distribution, the maintenance that Ashnafi was talking about? And secondary, what are the means that we can provide the information to have people in the field bring up their skill and for new ones to come in and join the community of clinical engineers. So the answer is that we are increasing our education capacity. We are trying to get grant and funds to be more frequent and with louder voice. And we are pushing academia to have more clinical engineering courses. So we will be ready for if there is a second wave. Hopefully there will not be one.
Thank you.
Thanks, Yanni.
Mohammed, let me also go quickly on the larger topic. The good news is we've got a lot of questions coming in and we're not going to have time to address them all today. We are going to be sending out a lot of references this week and another bolus of references that have been cited today. Some of the questions that are coming in, like around BiPAP and CPAP and so forth, are, there are 8 sessions, as we said at the outset, this month on Tuesdays and Fridays every week. And we've got the first 5 sessions lined up, as you saw, and we need other volunteers. But on the Friday session following this Tuesday session, it's an hour long, and we're going to work on mask and other PPE issues. But we're going to take an extra half hour and try to resolve, so it'll be an hour-and-a-half session, some of the questions that are left over from today. So that's a new feature. With this first time we're doing this, we're working it out as we go. But the great news is there's a lot of cool questions coming in. Some are going to be answered by other sessions. Some are going to be answered around oxygen, but later this week. So keep firing the questions. Back to you, Mohammed. And we've got only about 3 minutes before we come to conclusions. I know Bill Gentle's had his hand up for a long time. Perhaps Bill?
So one of the questions that Bill has is specifically on oxygen concentrators, and I think one of the questions earlier was on pulse oximeters. So my humble request would be that these questions be taken when we deal with pulse oximeters and oxygen concentrators later in the town hall sessions that we have. If Bill is fine. The other question that I wanted to have was, it's an interesting question from Tashi Penjore, which says how to decide on when and where, that is what type of healthcare facility, at what level to use oxygen cylinders versus oxygen plants.
Yeah, thank you, Tashi. And in reality, we do have that guidance in the book, and that was the slide that I showed. So I will send again the link, but actually that has, if you are using PSA plants or liquid oxygen and then piped for like tertiary care hospitals, and then be able to have used oxygen concentrators in others. But we want to warn that if there is no pipe lines, then it will just go to oxygen concentrators. So all of that is mentioned in the document, and also in the technical specifications that have the specifics on that. So that we're taking care of. We really would like to see that many of the ones that are in this call today, if they can go back to their countries, to their hospitals, and just fill in the inventory that was sent to you. I sent it to Tom, it's a Word document. But if you can fill it, and or if you can send me an email, then we can send you the electronic version so that you can fill it in. And then we have some idea of what is happening in the countries, what are the problems. But we're also asking how much do oxygen cost, because sometimes it is really unaffordable. Some other times is the machines are all broken. some other times. So we really need to have input in order to provide you something. And please know that there are many funding agencies, the Islamic Development Bank, the European banks, the DFID, USAID, many UNICEF that are providing now equipment for oxygen. So this will be the time that you can raise your request in your country. So contact your ministries of health, contact the WHO country office, and just share that information with them. And in the next seminars, we will be talking about other topics, but we'll also have a topic on the design of the treatment centers for COVID that of course require oxygen. So I think that there will be all these seminars. The idea is to provide all of you information so that you can ask us and you can provide us feedback from your countries so that then we can target the solutions for you. Over.
Thanks,
Mohammed, can I add?
Yes.
Mohammed? Yeah.
Yes.
I just want to add a couple of comments on this issue that Adriana has addressed about oxygen plant versus oxygen cylinder. I think we need to see it. We need to do a comparison about the supply, operation, and maintenance of these two sides of supply system for oxygen. So we need to look at the policy of each country, how to go about, is it a cylinder or is it an oxygen plant? I think we need to see the national policy of the country to decide which one is better. And we need to do both technical, financial, infrastructure, the HR, and different comparisons in order to decide which one. Thank you very much.
Thanks, Shnafi, for your comments. They are, I'm sure, certainly going to help us. I think we can still allow one question. Tom said that Bill Gentles had a question. Can we allow him for a question, please?
Go ahead.
And then we conclude.
Hello.
Who is the question coming from? I'm sorry.
Hello.
Question was from Bill. Is Bill around? His question was primarily on maintenance of concentrators. In many cases, he said they fail because zeolite cartridges need to be replaced. Can we develop a supply chain and a process for refilling zeolite cartridges, as replacement cartridges are very expensive and the supply chain for them is very low? Adriana wants to answer this. Please go ahead.
Yes, Hamid. I think this is a very important issue because we know, for example, in some countries, they had broken ventilators and they put a lot of money to repair ventilators. I think we have to do the same thing for oxygen concentrators. It is not good just to procure more and more, but then we're having a cemetery of broken concentrators. I think maybe then we can have a force maybe to repair all of them. But then it would be good if you send us your survey. If you tell us you have 20 concentrators and they're broken, we can talk with the manufacturers, because now, because there's so much sales impact, I think there's money around, and I think this is a good time to get them repaired. But then also it is good time to get the tools that are needed in order to repair them. And the third thing, we are having now the WHO Academy and others that are doing training courses. They want to develop training courses in general to repair and to use oxygen concentrators. So that's something that the persons that will be developing the courses, they are not specialists like us. They just put the audiovisual infrastructure. But so if CED can help us develop those training courses to use concentrators and to repair concentrators, that would be fantastic. Thank you.
And you know CED wants to do that. So Mohammed, please maybe begin the summary. Thanks.
Thank you so much, the presenters today, starting from Adriana Velasquez, our friend Ale from WHO, Ashnafi Hussain, and my fellow panelists for backing me up, Tom Jude, Yadin David, and all other friends for supporting this exercise. This was really wonderful. Some of the important points that came up through this discussion was that as a global community of clinical engineers, let us utilize this opportunity to strategically move a notch above, especially in the oxygen system, so that we have more reliable and sustainable oxygen supply mechanism in the country, which are more self-sustainable and reliable. So we could have better oxygen pipeline system with a approach on comprehensive medical gas pipeline systems. We could have more reliable power supply so that we could support our oxygen concentrators, our medical PSA generator plants. And also it is very, very important that we, the map that, the flowchart that Adriana shows, that we have a comprehensive oxygen systems mechanism in place, from oxygen therapy monitoring from pulse oximeters to how do you manage the quantities of the nasal cannulas, the oxygen mask, your oxygen analyzers and the maintenance components. All of them are very, very important. Then some of the important resources that were shared by WHO colleagues, I'm sure are very, very going to be very, very important. The tools that have been shared with us, especially to calculate our demands, more importantly, the surge demand in the time of crisis, to calculate how much oxygen need we will have, how much various consumables would be required, how much the different quantities of different health technology products would be required. I think that tool is very, very useful. We will have to adapt it for country-specific usage. Going forward, this is not going to help us only for the COVID-specific cases, but also ensure that we have uninterrupted supplies in our low resource settings, where the human resources and the supplies are a big challenge for all of us. So, so this tool is going to be very, very important. And then also we'll have to look at some of the contamination issues, especially when we take in and out the oxygen cylinders from in low resource settings in the ICUs and the medical wards. So we have to ensure that as a more sustainable and a safe and reliable mechanism, we do have a medical gas pipeline system, so that this concern of infection spreading is reduced to the maximum, and we also devise a mechanism for disinfecting them. So one of the important conclusion that today we had from the discussion was that the Clinical Engineering Division of IFMBE began doing evaluation of some of the important key products like oxygen concentrators and the newer ventilators that are coming. And this would primarily be based on feedback from the field and a user feedback, that which of the oxygen concentrators, which of the newer ventilators are actually working, and which of them have a problem per se. So this will not only help us the high income countries which already have a regulatory mechanism but do not have a good user experience sharing feedback mechanism, but also LMICs which primarily do not have a very robust regulatory mechanism in place, so which primarily depend on European CE or US FDA certification. So I think this is going to be a game changer for all of us. And then one of the things which was very time and again repeated, but a decision would have to be taken subsequent to this webinar was like someone in the chat mentioned that around 40,000 ventilators in African countries are dysfunctional. So we'll have to look at a strategy. And I think similar numbers would be also in the Indian subcontinent as well. So we'll have to look at a strategy, how IFMBE CED division, or how with the help of WHO, we could at least devise a strategy wherein we could train, or we could strategize the supply chain management of the important spare parts, the important consumables, so that at the last mile, these concerns of maintaining high-end ventilators and high-end equipment is not a challenge. This is it from my side. I would give it to you, Tom, in case I missed out, or Yadin or Adriana, if I've missed out something important here.
Mohammed, that's great. I'm going to give a couple people last words, and I'm asking all the panelists to write down the questions and next steps they heard for clarification, and we'll share those. But Yadin, last word, and then Adriana.
First of all, I like to thank the faculty for all the effort they made in being prepared for today. Excellent webinar, a lot of good information and dynamic exchange. Secondary, I would like to thank all the participants who listened and submitted questions. It helps colleagues, it helps the panel to focus on what we need to do next. What I learned is that there is a need for technical guidance on specific issue relating to oxygen generation, distribution, installation, maintenance, and servicing, like repair of concentrators and installation of concentrator. We will take that note and we will work on creating technical videos as a guide. Secondary, I understand that there is a need for guidance on what's considered to be a reliable list of medical products. It's going to be a major task because, as Adriana said, there are so many different out there. We will try to take a bite in the apple, as they say, and begin a list of what we hear from the field as being used and reliable equipment. And then we will work on increasing the human capacity of clinical engineers out in the field by networking and training, just as we do today. Thank you.
Thanks, Yadin. Adriana?
Thank you very much, all the participants, all the other panelists, and CD, IFMBE for organizing this excellent forum to share our information. Remember, we're there for the patients, but it goes through us. So we need to be the advocates that the right technology is given to the right patients. You need to contact your ministries of health and advocate for our field there and say, we are here to help and we can do a difference. So I just want to tell you that in this moment, just 2 minutes before closing, I received a Claude that is helping me upload the things in the website. He uploaded the survey. So now I just sent you the link so that please, you all fill in the survey and send it to us. And I want to thank Claude, even though he's not here, because he spent the whole day yesterday uploading everything so that you can have it today. So, and of course, all the people that are helping us, we need to know your needs. If we don't have feedback from the ground, we cannot provide what is needed. We all work for you and we all work together for patients. Thank you very much.
Thank you, Adriana. We need to fill out her inventory, and everything that's been put in the chat we'll also send out to the registrants. Thank you. Mohammed, close us out.
Thank you, Adriana. That was really helpful. And I so much agree with you. Unless we have our ears and eyes and all the senses on the field, we would, and proper feedback, we won't be able to help the patients. And as you always say, patient is at the center of all our strategies. And when the patient is at the center, as CED says, together we can make it better. Thank you everyone for joining today, and we hope to have you all in the following sessions. On the next session we have on Friday, the May 8th, on mask, respirators, face shields, and following that you can go on the CED IFMB website to look at the schedule for ongoing webinars. With this, signing out, good evening from, good night from Asia, and good morning to US and Europe. Good afternoon. Bye-bye. Have a nice day.
Thanks, everyone. Bye.
Thank you very much.
Thanks
all.
all.
Thank you, Amir. Thank you, Tom. Thank you, Elliot. Thank you, everybody. Yadin.
Thank you, Ashnafi, Adriana, Elliot. Thank you, everyone.
See you on Friday.
Yes, Tom, I just finished my slide just 2 minutes before your presentation. So, but I sent it to you, so now you can share it with everybody.
Will do. Yep.
Thank you for everything.
Okay, bye.
Be safe, everybody. See you again
Bye.
soon.
Thank you, Elliot.
Bye.
Like you,